Good morning. I'm Marilyn Huestis from the United States and Thomas Jefferson University. And today I'm going to be talking about the safety of kratom and new data, both epidemiological data and controlled administration data in animals and in humans. So first, from the FDA, their adverse event reporting system gives you some idea of the number of reports of adverse events related to mitragynine, and you can see in green, and it's similar to the number of adverse events reported for caffeine, and obviously much, much lower than the other problematic opioids. You know, we have a terrible opioid epidemic in the United States. So this is some of our first work on rats. We followed the FDA recommended protocol for evaluating respiratory depressant activities in animals, and they suggested using oxycodone as the positive control. We have 3 doses. The first is the therapeutic dose, the 6.75 milligrams per kilogram. And you can see that we, at the 2 higher doses, had significant increases in the partial CO2 pressure, showing respiratory depression, and significant decreases in the oxygen saturation. And if you look, you saw from Dr. McCurdy's work, we dosed up to 400 milligrams per kilogram, really high mitragynine doses. We had no significant change in respiratory depression. This is a manuscript that came out in very late 2023. It's from the largest forensic drug testing lab in the world, and they had many driving under the influence of kratom cases, 127, and they had over almost 5,000 postmortem mitragynine cases. In greater than 90% of those cases, they had less than 1,000 nanograms per mil of mitragynine, and they had intoxicated drivers with concentrations up to 1,000 nanograms per mil. And these are live human beings, yes, intoxicated, but nowhere near death. So they suggested that any concentration less than 1,000 nanograms per mil of mitragynine was highly unlikely to be associated with adverse events, including death. And yet around the world and in the United States, we have medical examiners and coroners reporting kratom deaths at low levels. It's actually as low as 30 nanograms per mil. And as you can see, we have individuals that are driving impaired at up to 1,000. We recently completed the largest and most comprehensive human kratom clinical study. We had more than 200 participants. We had 3 different kratom formulations, 4 doses, escalating doses. We studied a single dose of kratom and monitored all adverse events and pharmacokinetics for 10 days. And then we had 15 consecutive daily doses that we monitored again. I'll show you what we monitored. A very intensive study following up the chronic dosing for 23 days. You can see that we monitored both chemistry, hematology, adverse events, respiratory, cardiovascular, cognitive. We monitored many, many aspects looking for the adverse events. What we found is after 15 daily 4,000 milligram kratom doses that contained up to 53 milligrams of mitragynine, we reached plasma concentrations up to 215 nanograms per mil. And when they received the higher mitragynine isolate dose of 15 daily doses up to 89 milligrams, we have concentrations up to 753 nanograms per mil in volunteers who are working and who are going to school, and they come in and get every dose was observed. We had no serious adverse events, and they went back to work or school. So in conclusion, It's critical that comprehensive toxicology be performed in these, quote, kratom-caused deaths, because in more than 90% of these, we find multiple other drugs, including potent opioids like fentanyl, oxycodone, um, antidepressant drugs, benzodiazepines. So one of the biggest issues we've seen is where there's limited testing. They find the kratom in the home where the individual is using it to help control their illicit drug use, opioid use, benzodiazepine use, etc. And most of these deaths, the individuals have multiple drugs on board and have a history of illicit drug use, and including novel psychoactive substances, which of course is a big topic of discussion here at this meeting. And most labs do not test for NPS. When we have drug cases where we can go back and do more comprehensive toxicology, we almost always find the presence of other drugs. There's a lot of new data, both epidemiological and controlled drug administration data, to inform pathologists and medical examiners of the effects of kratom and the relative safety and the drug concentrations that you find in individuals that do not show any signs of toxicity. So metragenine is not an opioid based on its chemistry or its pharmacological class. As you heard, it does have some mu opioid receptor activity, but lots of other complex pharmacology as well. And we've shown no respiratory depression in both animals and in our clinical study. However, consumers need to be aware that they should not be taking really high doses of kratom, and they should not be mixing it with other drugs. Thank you very much.